patients have chronic elbow pain, what often happens is they have an injury, whether they are playing tennis or golf or what have you, and that injury, if it doesn't get better, quickly or doesn't resolve in a few weeks, what actually happens is that initial tendinitis phase or inflammation of that tendon actually turns into a tendinosis or degeneration of that tendon. That inflammation doesn't last chronically, but what actually happens is that tissue and cells at that tendon start to die and start to degenerate, often leading to chronic pain. Patients with chronic elbow pain, whether it's on the outside of the elbow or the inside, will often try things like ice, anti-inflammatory medications, maybe even putting like K-tape or kinesio tape on it, physical therapy, rest, kind of the gamut of things that maybe we've all tried to help heal injuries. When that often doesn't work, that's when they come to us, to look for an alternative treatment option to get back to golf, get back to their sport, or just be able to lift a gallon of milk without pain. Prolotherapy or proliferation therapy is actually an injection technique that can work to regenerate that degenerated tendon. It actually signals to the body to send more growth factors and platelets and all sorts of that good stuff to make new healthy tissue. There are times too where someone maybe has had, chronic tendinosis or tendon degeneration, and they actually develop tears in the tendon as well. Just little partial tears in that tendon and the substance of it. We actually, when a patient presents with just lateral elbow pain, let's say, we can actually use our ultrasound machine, instead of sending patients for MRIs, see, okay, is it just degeneration? Is there a tear there? And actually guide our therapy directly into those areas to make sure that they're healing well. Oftentimes if someone has a tear, we may want to even actually concentrate growth factors from their blood and inject it in that tendon for more optimal and quicker healing. And the ultrasound machine actually allows us to differentiate between that too. Is it a tear? Is it not a tear? Should we start this therapy sooner rather than later to meet our goals and get that patient back to sports, exercise, and daily living without pain?